Hello, now let me show you how we record vitals data for a patient and how a patient enters their vitals data both manually and through a connected device like a pulse oximeter. Here we have the patient list underneath the company menu item, and I'm going to look at Bill Aaron and review his demographics, his personal information, his contact information, his insurance information, his login information. This is how Bill Aaron logs in to the system. We don't know his password, but indeed we do have his username. And this unique username is what ties together and connects the data from the eCare21 app that Bill Aaron is using and the clinical documentation backend provided by eCare21 so that nurses, physicians can review and assess a patient at a distance. Of course, this green button is used to show the user's initial username and login credentials, and you can print that off and give it to the patient when they first come into the office and sign the consent form for RPM. I can also click on monitoring devices, and this is where I could see the devices that Bill Aaron is using to report his data. I know Bill Aaron has a set of iHealth devices, and they connect with the Apple Health Kit. iHealth also connects to the Google Fit on an Android device, but I see Bill Aaron is using an iPhone XR. Bill Aaron is using iHealth for his blood pressure. I know he has a Fitbit for his calories. iHealth again for glucose, heart rate. He does not have a connected device for mood, but he could enter it manually. And pulse ox is coming in from iHealth. Pain can also be monitored and entered manually. Sleep is recorded by his Fitbit device. Steps by his Fitbit device. The temperature is being recorded manually, and it comes in through the Apple Health Kit. And his weight is also an iHealth device. What I'm going to do now is show you how we can set him up for consent. This is how the consent is logged in eCare21. Typically, the patient comes into the office for a visit, and the doctor reviews with them the CCM and RPM program. There's a consent document that is presented to the patient, and upon the patient's review and acceptance and signature, that document is scanned and stored in the eCare21 database. There is also ability for eCare21 to record the verbal consent prior to the office visit, as long as in the next office visit the patient comes in and signs the consent form. Again, down here, we have a list of the patient's providers. This patient has a cardiologist as well as a primary care. And we look at the nurse assignment. Here, Dr. Laura Smith is assigned to the patient. The patient's health information, their diagnosis information, which ones are their chronic diagnosis, which are primary. Their goals are recorded from the care plan, both clinical goals and personal goals. And if there are any inactive goals that have been recorded, those can be moved up to the top at any time if it's determined that we want to work on something that's down below that has been deprecated or made inactive. So if the patient you believe needs to lose weight, we can click this one here and activate it, and it will be moved back up to the top as a clinical goal. Status can be recorded by simply clicking the plus sign, and you could record a status, enter it in the system, and now that patient has it in their care plan. We can now move from goals to barriers. These are also informed from the care plan. And you can see on the top, we have the active barriers that you're working on with the patient, as well as any progress comments. any allergies recorded, latex in this case. And now we move down to where the patient is being questioned periodically about their progress on their care plan. And here we have the ability to open a questionnaire, and that questionnaire allows us to record the interview with the patient. And it's a quick checklist that is based on their chronic conditions. In this case, we have two primary chronic conditions, diabetes and hypertension, and we've selected these two as their primary chronic conditions we wish to question them on. And periodically, we're going to record information, answers to their questions down below. And as we record that information, it's informing the care plan. It's moving items into the care plan for further follow-up. So as we check items in here, we're informing the care plan. And this document also is being recorded and logged as an activity for chronic care management. All outcomes are recorded and their goals based on their specific condition and their barriers. And again, these goals and barriers move into the care plan that I showed you before. Time is recorded here, and you could have a reference timer down in the bottom right-hand corner. You can use that, and then add any prep time or post time with the patient to record the time you spent doing this CCM progress review. Once this time is recorded, it is stored and logged, and I can save this in the patient's plan. Next, I'm going to show you the monitoring plan. And I'm going to show you how, in a separate video, how to edit the monitoring plan and how to enter monitoring data for this patient, and then to periodically follow up and review the patient's trends and how they're progressing towards their goals. Thank you.